Every November, as we enter National Alzheimer's Disease Month, we're reminded that just here in the U.S., more than 5 million people are suffering from Alzheimer's disease.
It's a lot of responsibility to take care of them.
And it doesn't play favorites. It could hit close to home and afflict one of your loved ones, or strike one of your favorite celebrities such as Glenn Campbell, Jack Hanna, Tony Bennett, or late President Ronald Reagan. And as pervasive as Alzheimer's is, it's just as mysterious. Medical science is making progress toward treating the disease, with the FDA recently approving a new drug. But its cause and cure are yet to be discovered.
It can happen for 30 or 40 or 50 different reasons in people.
For those who suffer from Alzheimer's and their loved ones and caregivers, there is still much hope. Los Angeles County offers technology to those who might wander off or get lost in the form of an electronic tracking bracelet.
This Project Lifesaver was able to literally save his life and save his way of life, too.
Hello, everyone. I'm Hal Eisner. We're shining a light this week on what some have called the cruelest disease because it steals a person's mind and personality until they're no longer who they used to be. We're talking, of course, about Alzheimer's disease. Dr. Suzie Bash is a neuroradiologist with Radnet. Good to see you again. Thanks for joining us. And let's start off, Suzie, with the notion of what is Alzheimer's disease? How is that different from dementia? How is it diagnosed? Give us sort of the cliff notes here on Alzheimer's.
Sure. Alzheimer's disease is a progressive neurodegenerative disorder that initially manifests as memory loss, but eventually will cause the loss of ability to have meaningful conversation and even meaningful interaction with the environment. And it really results from a buildup of beta amyloid plaque and neurofibrillary tangles in the brain. And it's actually there's a lot of different causes of dementia. Alzheimer's disease is the most common cause of dementia, over 60% by autopsy series. And unfortunately, it affects 6 million Americans and 50 million people worldwide. So 1 in 3 seniors will die from Alzheimer's disease without an effective treatment. And so it really kills more people than even prostate and breast cancer. And those numbers are unfortunately rising. So since 2000, the death rate from heart disease has gone down 7%, but the death rate from Alzheimer's disease has unfortunately gone up by 145%.
Let me be kind of a dummy here for a moment, because I know you know this stuff really well. And I know that, for you, a lot of things are very simple. But for me, I need to be even more simple. So when we use the terms Alzheimer's or dementia, and we use those interchangeably, is that the right thing to do, or are they different in some way?
Well, they differ only in the sense that there are many different causes of dementia. So you can have frontotemporal dementia, dementia with Lewy bodies, vascular disease, when you have a lot of infarcts and microvascular ischemic change, that can result in dementia. So there are a lot of different kinds. And Alzheimer's disease is one form of dementia. It just happens to be the most common form of dementia. And
it's one of the most awful diseases around, because all of a sudden you're looking at somebody you've known all your life and they don't recognize who you are.
Absolutely. Absolutely. It's a huge health population, issue.
And so what's been done? What progress are we making? I remember hearing years ago that they were working on something that could maybe make a difference. Are we there yet?
Well, there has been a lot of advancements. Well, first of all, there are certain things that you can't do to prevent Alzheimer's disease. There are non-modifiable risk factors like your age. It goes up in frequency every 5 years after the age of 60. It will double in frequency. Your genetics, you can't really do anything about that. And also sex, it's more common in women. But there are a lot of modifiable risk factors that we can do to help prevent, and we can talk about that. But one of the big things, as you mentioned earlier, was the FDA approval back in June 2021 of the first potential disease-modifying therapy for Alzheimer's.
What does it do? What does it do?
Yeah, so it's a monoclonal antibody, and it attaches to the beta amyloid plaque, and that triggers your immune system to help clear the beta amyloid plaque from your brain. And what we do know is that this therapy is very, very good at removing that plaque, which is a hallmark of Alzheimer's disease. So the patients in the trials had an amyloid PET beforehand. By the way, amyloid PET will pick up beta amyloid plaques in the brain up to 20 years before the patient becomes symptomatic. So they looked at the amyloid PET beforehand and then after they administer the therapy, and it did an excellent job of clearing that plaque.
So basically, just before you go, basically, if you get rid of the plaque, you prevent the potential problem?
Well, that's a very interesting point. We don't know yet how efficacious it will be. So there were two major trials. Biogen did two major trials. And in only one of those two trials did we see a 23% improved cognition in the high-dose limb. But in the other trial, we didn't see it. So part of the FDA accelerated approval program requires that an efficacy trial must take place, a phase 4 clinical trial, which was targeted to start in January 2022. And so Biogen now must show through a larger trial whether the medication, this therapy, is actually efficacious in improving cognition. So we know it does a great job of removing the plaque, but whether that will translate to improved cognition, that still awaits to be seen.
So this drug you've been talking about, what's the name of this drug?
Aduhelm.
Say it again? Aduhelm?
Yes, Aduhelm.
And so is there great hope? Is there great, but where are we? I mean, are we looking at this like this may be the thing that makes a big difference, or it's one of the things along the way to try to get to something that makes a big difference?
Yeah, so Hal, I do think there is hope. I mean, if you have a loved one, I mean, obviously you would want to have that beta amyloid plaque cleared from the brain. But again, we don't yet know how efficacious it will be because it only showed positive improvement in cognition in one of the two trials. So we're going to have to wait a little bit to see how efficacious it is. But having said that, Aduhelm, that's the first, potential disease-modifying drug that's ever been approved. So that's fantastic. But it's also not going to be the only one we see. So Eli Lilly has a monoclonal antibody that received FDA breakthrough status. Again, not approved for clinical use yet for the Eli Lilly drug, but in other words, there will be other drugs that are coming on the heels of Aduhelm. So
we only have about 30 seconds left. Is there anything we can do? Anything in that half minute? Anything we can do ourselves?
Absolutely. So if you can control your blood pressure, maintain control of diabetes, get good exercise, maintain a good body weight, avoid excessive alcohol and stop smoking, and remain cognitively active. Keep thinking and doing these kinds of activities. Try to prevent social isolation and treat depression, and also get good night's sleep every night. Those are all things that we can help do to mitigate against this awful disease.
All right, Dr. Suzie Bash, good to talk to you again. Thanks so much. And again, this whole half hour is about Alzheimer's disease. So.